You never thought it would happen to you. And then there he was, unconscious. He wasn't moving. It was a heart attack.
Okay, we'll get someone in here. When someone close to you falls unconscious, will you know what to do? This short videotape will teach you the basics of cardiopulmonary resuscitation, or CPR. CPR is a proven technique that gives a person the best possible chance to survive until help arrives. You're never too old to learn CPR, and if you do, one day you may save the life of someone you love. Sudden death from heart disease is the leading cause of death in America. Most sudden deaths take place right in the home. A person collapses sometimes after feeling chest pain, but other times with little or no warning.
Mike? Mike! Mike, what's the matter?
The person
Mike,
loses
are you all
consciousness,
right? Mike, can you
and breathing
hear me?
becomes irregular
Mike?
or stops completely. When this happens, you need to call 911 immediately and do CPR to keep the person alive until help arrives.
Hello? Hello, can you help me, please? My husband is unconscious. I can't get him to respond to me. Could you please come? It's 2201 Puget Lane. The name is Nichols. It's Mike Nichols. Yes, I think I can do CPR, yes. Yes, thank you. Mike?
Lay the person flat on their back, on the floor if you can. Place one hand on the forehead, the other under the chin. Tilt the head back, lift the chin until the teeth almost touch. Look and listen for breathing. If the person is not breathing normally, pinch the nose, open your mouth wide and place it over the other person's mouth. Make a tight seal. Give 2 full breaths. Feel for a pulse at the neck. If there is no pulse, bare the chest. Position your hands in the center of the chest between the nipples, with one hand on top of the other.
2 and 3,
Push straight
4,
down 2
5,
inches.
6,
Do this
7,
15 times.
9, 10, and 11, and 12, and 13, and 14, and 15.
Give 2 breaths, then 15 pumps.
And 1, and 2, and 3.
Counting
4,
out loud will help you do a
5,
better
6,
job.
7,
Keep doing
8,
this until
9,
help arrives.
10, and 11, and 12, and 13, and 14, and 15. One, and 2, and 3, and 4, and 5, and...
By following the basic steps of CPR, you may be able to save a life. You may be scared, nervous, and anxious, but don't hesitate. The 911 emergency operator can help you by talking you through the steps of CPR, so don't hang up the phone. Do the best you can, and don't worry about doing it perfectly. You can do it, and you can save a life. Imagine yourself performing CPR. Here are the steps again. To better demonstrate CPR technique, we'll use a mannequin especially designed as a teaching aid. First, check for unresponsiveness. If there is no response, dial 911 and return to the person. Position him flat on his back. Kneel at the side. Place one hand on the forehead, the other under the chin. Tilt the head back. Lift the chin until the teeth almost touch. Look and listen for breathing. If the person is not breathing, pinch the nose, cover the mouth, give 2 full breaths. Put the fingertips of your hand on the Adam's apple. Slide them into the groove next to the windpipe. Feel for a pulse. If you can't feel the pulse or are unsure, move on to the next step. Position your hands in the center of the chest between the nipples. Place one hand on top of the other. Push down firmly 2 inches. Do this 15 times.
12 and 13 and 14 and 15.
Give 2 more breaths. Then push down 15 more times.
4,
Keep
5,
doing it.
6,
15
7,
pushes,
8,
then
9,
2 breaths.
10, 11, and 12, and 13, and 14, and 15. One and 2 and 3 and 4 and 5 and 6 and 7 and 8.
Continue this
9,
until help arrives and takes over.
12 and 13 and 14 and 15.
Remember these 5 important steps. Number 1, call 911. 2, tilt the head back and lift the chin. Check breathing. Number 3, pinch the nose, cover the mouth, and give 2 full breaths. 4, check for a neck pulse. And 5, if there's no pulse, pump on the chest 15 times. Give 2 more breaths, then push down 15 more times. Keep doing it. CPR buys time until help arrives. You have nothing to lose and everything to gain by trying. This has been a demonstration. In a real emergency, you would push deeper, as you saw on the mannequin. Don't practice pumping on a real person's chest. You could cause injury. In an emergency situation, however, any chest injury caused by pumping is a small price to pay for saving a life. After reviewing this video, you might want to sign up for a training class. This will give you hands-on practice with a mannequin. Call your fire department, the American Heart Association, or the American Red Cross. To improve and maintain your skills and to prepare you to act quickly, watch this tape frequently and practice with a family member or friend. Ask the person to lie down. Practice tilting the head back and lifting the chin like this. Look, listen for breathing. Find the pulse. Gently feel in the groove next to the Adam's apple. Use your index and middle fingers. You can also find the pulse on yourself. Practice finding the correct hand position on someone else by finding the center of their chest between the nipples. But remember, do not pump on the chest of another person unless it's a real emergency. With a little practice, you could do it if you had to. CPR can save a life, and you can do it. In good health, I'm Dan Lewis.